Most of the time, good. Just one occasion, it wasn't so good. I was waiting to get treatment done, laser treatment, and I went to the consultant and I told them that I was concerned about the procedure because I'd seen somebody that had it done and they looked really bad, and he just went, "Oh, aye, you will be." But then later on I went to a different consultant for the same procedure and he was completely different.
Sometimes when I was first diagnosed with it years ago, when I was a teenager, when I was saying neurofibro what? And so I just think the doctors should maybe have more awareness of it.
A lot of GPs hadn't actually heard of it or wasn't very knowledgeable on it, so I got a card from one of the paediatricians that had a website about neurofibromatosis, and then that's how I came about the Facebook page of all the support group. So that's how I became more into it and finding out more information, because the GPs couldn't really tell me much.
It's certainly more positive than it used to be. And I also have experience listening to other people telling me what their experiences are and talking to health professionals on other people's behalf. It certainly has improved, but I think there's still a long way to go, especially with a condition like neurofibromatosis, where such a huge percentage of the people have learning difficulties. I think the health professionals tend to forget when they're talking to somebody with learning difficulties that they're not quite on the ball and not quite taking in what's being said to them. But people with learning difficulties are very good at nodding their head and might walk out of there leaving the health professional thinking they're fine with that.
They don't seem to have an understanding at all about the condition, and even once they know the name of the condition, they don't seem to want to find out the information. They just seem to kind of muddle through with what information you give them.
Well, I'm in hospital quite a lot of times getting operations, seeing GPs, but they've all been like really nice, understanding. Some of them, when you say you've got the condition, they panic. Some of them don't have your notes, so they kind of have to ask you and get other colleagues to get their help.
Mixed, really. Some of the experience has been very good and very positive, and others has not been as helpful.
Niamh's very interested in learning about her condition, so we try to make sure that she actually gets a chance to ask the questions that she wants to ask while we're at the doctors, and the doctors are usually very good at explaining it on a level that Niamh can understand.
Although I had Anthony at psychologists, I had him at doctors, I had him at the autism awareness, and everybody told me I was a neurotic mother. Nobody would listen to me.
My boy took cancer over 2 years ago, and it was a paediatrician. I had to fight to get in to see her. "Oh, you've got an appointment for January." I said, "I can't wait till January. I need to see you the new." And later on down the line, it was a case of, "You know what, Mrs. McPhee, I learn from you." I says, "Well, how can somebody like you learn from me? I'm just a mother." She says, "Always to go with the mother's instinct." So I'm like, yes. I felt brilliant.
We all must appreciate that health professionals can't be expert in absolutely everything. I think it's best when health professionals recognise that they sometimes don't have the expertise required, and then refer patients to people who do have the appropriate expertise.
To listen to me. It doesn't matter whether it's NF or whatever, when you go down you want them to listen.
I think it should be so that you feel comfortable talking to them and not them think, "No, you're stupid." Even if you think it's maybe a silly question and saying, "Oh, I don't want to ask this," but you feel comfortable enough to ask the question.
Absolutely has to be a partnership. When it's a rare medical condition and a complex condition, there has to be a two-way relationship, and the medical professionals taking on board the expertise that members have often accumulated over the years.
I'm not saying that every health professional should know about every condition, but I think once they're aware that that's a condition that's affected your family and they're going to be in touch with you on a regular basis, that they should then do their bit to find out some more information.
I think the health professional should become more involved in trying to find out more about it rather than just try to send somebody away trying to look for information on the websites.
I think there should be a really strong partnership working. I think if someone has a long-term condition, they're the expert in their condition. They're the one that lives the life. And there should be a good partnership working between them and all the healthcare professionals involved in that management.
I think it's very important, and I think health professionals need to realise that the carers probably know more about the condition than the health professional will ever know, because they live with it on a daily basis.
Absolutely. I think it could be invaluable. I think it's a resource that will appeal to a lot of members. And I think just hearing someone relay their experience, etc., could be absolutely useful. Yes.
I think it's a good idea because people don't know about it, and if there's somebody that talks to them, it might help them in the long run. It's a good idea to let people know, and it's up to them to, if they want to take the advice or what's on offer.
Absolutely, because there's probably lots of kids out there and they're getting misunderstood.
Yes, it would raise awareness for one thing, which is a good thing, because if awareness is brought up about this, more people become knowledgeable of the illness, of the condition, and it would help a lot of people in my situation.
Perhaps an encouragement to people with long-term conditions to take more control over their own life as much as possible, and maybe a benefit to the healthcare professionals to let go some of that control that they seem to want to take over other people's lives.